Hi, and welcome to Hello Live. I'm Pamela Hadfield, the co-founder of HelloMD, and I'm joined here today with Dr. Patricia Frye, our Chief Medical Officer. And today we're here to talk about cannabis and epilepsy. In the 2013 documentary entitled Weed, which featured Dr. Sanjay Gupta, they talked a lot about a little girl named Charlotte who suffered from severe epilepsy. And through her use of CBD, she was able to get rid of her seizures. Well, since that time, CBD and the consumption of cannabis has skyrocketed due to its ability to help those people who have seizure disorders. But before we get more into it, I'd like to welcome you, Dr. Frye, and find out, how did you end up here today talking about cannabis and epilepsy?
Well, I'm happy to be here, and I got here, believe it or not, through HelloMD. It was my first introduction to cannabis medicine. And
you were our first doctor. She's number one.
I was your number one doctor. And I learned so much from the patients and studied and went back to school, and I have been practicing cannabis medicine ever since. And with the experience of seeing thousands of patients and managing a number of clinical conditions, I wrote a book. It is the Medical Marijuana Guide, Cannabis in Your Health, and I am happy to be here and talk about some of the conditions that I see on a daily basis.
And I can't say enough about your experience, Dr. Frye. She is one of the nation's leading experts in cannabis across multiple conditions, as you stated. You've seen thousands of patients, and over the years, you've really become a leading expert in the field. So we are so happy to have you here today, especially when we're talking about such a serious condition. So I'm going to dig right in and ask you the first question about cannabis and epilepsy. Are you ready?
I'm ready.
Well, actually, this one isn't about cannabis. This is more general. So what causes epilepsy, and how is it usually treated?
Well, we don't really know what causes epilepsy. Epilepsy, by definition, means a patient is having recurrent seizures, multiple seizures. And these can occur after an injury, which could be from an accident, or it could be injury to the brain from surgery. There could be a genetic predisposition to seizures. Patients with autistic spectrum disorder tend to have seizures in about 35% of those cases. There could be a serious infection to the central nervous system, like meningitis or encephalitis, that may result in seizures. Or there could be a growth, either a benign tumor or a malignant tumor, and they can also cause seizures by irritating the brain tissue. We typically treat seizures with pharmaceuticals called anticonvulsants, and these medications alter the flux of ions and neurotransmitters in the brain. They're effective most of the time. Some patients don't respond well to anticonvulsants, and sometimes we'll do dietary alterations, like introducing the ketogenic diet, which also will raise the seizure threshold, meaning that they're not likely to have as many seizures as they had.
And some people respond well to the standard pharmaceuticals.
Yes, many do. Many respond well and tolerate them fine. There are others who respond well and have adverse effects from the medications that make it difficult for them to continue with them. And then there are those who just don't, we just can't get a good response.
All right, well, that's all very good to know. And are you ready for our first Did You Know fact?
I'm ready.
Okay, I bet you already know this, but did you know the most common diagnoses are found in people before age 20 or after age 65? A quarter of all diagnosed epilepsy cases are found in children who tend to grow out of the seizures after proper medication is consumed.
Yes, I did know that, and oftentimes those children, if they go for an extended period of time, they can be weaned off of the medications.
That's great. That's good to know. So on to our second question, which is, are there specific types of epilepsy that cannabis may help?
Well, yes. tonic-clonic seizures seem to respond to cannabis. Those are what are also called the grand mal seizures. You can have clonic seizures, drop seizures, where a patient just becomes, loses consciousness and their head drops. They're what they call myoclonic seizures. Those all do tend to respond to CBD. I have patients, especially children, who tend to have seizures as they are either falling asleep or going from one stage of sleep into another stage, or are arousing, waking from sleep, and they may have their seizures at that time. And then there are partial complex seizures, which are a little different. And they oftentimes involve a different area of the brain. The partial complex seizures, in my experience, seem to respond better to THCA. And THCA is a cannabinoid, which just means it's a compound found only in the cannabis plant, and it's the precursor to THC. And THCA turns to THC by heating it. Heating the flower or the plant.
Meaning before it's converted to THC, THC is non-psychoactive.
Okay, THCA is psychoactive, but it's not intoxicating.
Okay.
And there's a difference, because even these raw cannabinoids that people tend to kind of say, oh, they're not important. A lot of the language refers to activating cannabis by heating it. Because that was the thought that it was only the THC that had medical benefits, but actually these raw compounds, these that are in an acid form in the unheated plant, also have medical benefits. And one of the medical benefits of THCA is that it's an anticonvulsant.
That's fantastic. And what about just regular THC and CBD?
CBD I use mostly for those tonic-clonic seizures, the more typical seizures, and CBD is actually FDA approved for seizures in 2 syndromes, Dravet, which is the syndrome that little Charlotte Figi has, and Lennox-Gastaut. And those patients have many seizures, 20, 30, 100 seizures a day.
Which becomes very dangerous.
Oh, it is. It is very dangerous, and it also impacts their development. Children can't learn and develop when they are in an altered state of consciousness, and it is not that CBD only works for those seizures, but it was those 2 syndromes that were studied and presented to the FDA. So if a patient has Lennox-Gastaut or Dravet, then Epidiolex, which is a CBD product that's made from the plant, is the first pharmaceutical. It's not really a pharmaceutical in that it's synthetic, but it's the first FDA-approved cannabinoid medicine made from the plant. THC has an anticonvulsant properties, but only at low doses. You have to be very careful with THC, because THC at higher doses can actually lower the seizure threshold, so it would make the patient more prone to have a seizure.
That is fascinating, and I just want to remind everyone in the audience, because this is such a complex subject and your answers are amazing and also a little bit complicated. If you have any follow-on questions or just questions in general about cannabis and epilepsy, please use our live chat, type your question in, and one of our Hello MD doctors will answer. And so, thinking about the audience at this point, we do have an audience question, which is, I didn't know there were multiple forms of epilepsy. Can you still have a seizure if you don't have epilepsy? What a great question.
Well, yes. Epilepsy means you've had some seizures or recurring seizures, but there are other conditions that can cause a seizure. Children can have a febrile seizure. That doesn't mean they have epilepsy.
What's a febrile seizure?
Generally, a child is sick with a viral upper respiratory tract infection, and their temperature goes from normal to high rather rapidly. And generally, the temperature is in the 104 range, but it could happen at any temperature over 101, 102. That tends to run in families, and that tendency to have a seizure with a fever, generally they outgrow that. So we don't call that epilepsy. A patient may have a head injury and have a seizure right after. If they don't have any more seizures, That's not what we call epilepsy. A patient could have an electrolyte imbalance, severe dehydration, and have a seizure. But if they don't have any more seizures, that's not epilepsy.
Got it. Well, are you ready for our next good to know or did you know fact?
I'm ready.
Okay. So medication for epilepsy works for most patients, but at least 1 million people in the United States suffer from uncontrolled epilepsy, meaning medications don't help them. In these circumstances, some patients turn to alternative medicine, including cannabis, which begs the question of what other alternative medications may there be. So what do you think about that?
Well, I'm thinking that then we're talking about ketogenic diet. We might be talking about vagal nerve stimulation, which is sometimes a surgery that's done to stimulate the nerve that comes from the brain and goes down into the GI tract. Those are the two that I think of. There are surgeries where they can have what they call a foci, where they see abnormal electrical activity. There could be, like as I mentioned, a tumor or some a growth or abnormality in the vasculature where they may try to remove that. But I don't know of, I can't think of anything in terms of alternative medicine other than cannabis that might be used for seizure control.
Well, this leads into our next question, which is why does CBD seem to work for some types of epilepsy, but not as well for other forms of epilepsy? And so maybe you can at least first start talking about cannabidiol and CBD and what that is, and then why it may or may not work.
Well, I can answer that question pretty quickly. We don't know. Okay. We just don't know.
Yeah.
We don't know why CBD doesn't seem to help with partial complex seizures. In my experience, CBD seems to be more effective in treating seizures in children. It seems to be more effective than treating those in adults. But we really don't have a clear understanding of why that is. But it's just like any other medication. Not everyone responds to every medication, and cannabis is no different. We each have an individual endocannabinoid system, and your endocannabinoid system is different from my endocannabinoid system. And these receptors respond to these cannabinoids differently. So I may use a cannabis product for, let's say, anxiety and get relief. You might take the same product and not have any benefit. So it's like any medication. Nothing works 100% of the time. In order to be FDA approved, patients need to demonstrate that patients will experience at least a 30% improvement in their symptoms, and that only needs to happen in 30% of the people who are using whatever it is they're testing, and there needs to be a significant difference between that and placebo. So no one's looking for 100% in anything in medicine.
That's remarkable that it has to be, it's actually that low to be FDA approved, because everyone always thinks that medications that the FDA approves are automatically safe, which isn't necessarily the case, but that's almost another topic.
Well, they're mostly safe, and that is another topic, but what we're looking at is efficacy, how well it works. If we look at the use of antipsychotics in children with autism with irritability and aggressive behavior, the FDA has approved the use of antipsychotics for that behavior, but the studies only show that it's efficacious 20% of the time. So the standards are not anywhere near 100%. And so we can't hold cannabis to 100% because we don't do it for anything else.
Well, I think it's just like with everything. Typically the one-size-fits-all does not work.
It doesn't.
Okay, so on to our next question, which is, how is the endocannabinoid system involved in epilepsy?
Again, we don't know. The endocannabinoid system regulates a number of neurotransmitter systems. One of those systems is something that's called glutamate, and it's an excitatory. It revs things up, and we have GABA that slows things down. And when the regulation of that glutamate activity is off balance, you can have increase in electrical activity in different areas of the brain that could stimulate seizure activity. So it is the endocannabinoid system's purpose really is to create homeostasis or balance. So most people don't have seizures, most people don't have muscle spasm, most people don't have incapacitating anxiety. And sometimes when that endocannabinoid system is not able to keep things in balance, then we have what we call dis-ease, and that's disease or medical conditions that cause problems.
That's a great answer. And I'm just going to turn to the audience again and just let you know, if you have any questions about this complex topic, cannabis and epilepsy, please be sure to ask that in our or ask them in the live chat, and one of our Hello MD doctors will answer the question. Okay, so moving on to an audience question. Are there other lifestyle changes you can make to prevent seizures?
You know, I mentioned the ketogenic diet. That would be a lifestyle change. Certainly, some patients are more prone to seizures when they're under a lot of stress. So making changes in your lifestyle that minimize stress, or even using CBD during the day to help interrupt that stress response may help. Certainly getting enough sleep can be very important, although in some seizure disorders, as I mentioned in children, sometimes it's sleep that is where they have their seizures, but oftentimes for adults, if they aren't rested, if they're tired, that makes them that will lower the seizure threshold and make them more susceptible. More susceptible, yes.
Are there any environmental reasons that people would have a seizure, or have epilepsy, or cause the seizures to come on?
I suppose that there are a lot of sensitivities that we don't have a whole lot of understanding of. For instance, we could have environmental situations like mold. Mm-hmm. I have a little patient, little 10-year-old, just turned 10, and has a seizure disorder that we've been treating with CBD, and then we moved to THCA. And his seizures definitely improved with THCA, but there was a water problem in the house, and once that mold issue was taken care of, actually I think the family moved. Once they moved, the seizures went away completely. Yes, so there's a lot that we don't know about environmental factors or toxins, but certainly that can factor in.
It can play a role. Mm-hmm. All right, so the next question. Cannabis is known for being an anti-epileptic, but some people also believe that it actually causes seizures. Which of these is true?
They're both true.
Ooh.
THC has what we call a biphasic phase, or biphasic effect, and CBD has a biphasic effect as well, but it doesn't tend to cause seizures. But THC at low doses is an anticonvulsant. At high doses, it can be a proconvulsant. So patients need to be careful if they have a seizure disorder to limit the THC, because at too high a dose, and then if the next question is, well, how high is too high, the answer is it depends.
It really
Everyone
depends.
responds to it differently, but you have to be very careful with THC if you have a history of seizures.
And so your advice as a doctor would be to somebody like that, how do you advise them?
I advise them not to use any, certainly don't use any THC dominant inhalants. I have a patient, an adult patient with partial complex seizure disorder, who was fairly well controlled and went to the dispensary and bought a vape pen that was 78% THC, and she took 2 puffs and had a seizure. So, so you want to stay away from inhalation, because that's too rapid an introduction of THC. It goes right into your bloodstream like IV. It goes zooming past that blood-brain barrier, and if you're going to precipitate a seizure from THC, that's a good way to do it. So THC, maybe a tincture, very low microdosing, but THC can cause a seizure.
That's excellent advice. So on to our next Did You Know?
Mm-hmm.
Are you ready?
I'm ready.
You're always ready. Okay, a New York Times Magazine article recently highlighted the benefits of CBD in treating seizures, among other things, focusing on the story of a Mill Valley mother and her epileptic son, Ben. Her son's condition resisted all kinds of medications, and only when she turned to CBD did Ben begin to improve. Is that a typical response with children who have epilepsy with CBD?
It's a common response. I can't say that all children respond to CBD, but in my own experience, and obviously from the Epidiolex study, a significant number of children get better. The frequency of the seizures will decrease. Some will have no more seizures. I have one little fellow who had infantile spasms who had multiple seizures during the day. After, about a week, 10 days on CBD, he no longer had any seizures.
That's fantastic.
He gets them now with a cold or something, but either the frequency goes down, the severity of the seizure can decrease, and the duration of the seizure can decrease, and all of those are beneficial.
That's such good news, and also considering the fact that we were talking about cost and benefit of children in consuming cannabis, but with CBD, I don't think that there's much downside to trying this.
Right, we're looking at benefit versus risk, and the risk of having seizures is certainly greater than the risk of using cannabis.
Okay, so our final question is actually an audience question. Can CBD interact with any medications, including anti-seizure medication?
That's a really important question. I'm glad they asked. Cannabis, CBD in particular, CBD being the non-intoxicating compound of the plant, it uses an enzyme that's in the liver that metabolizes about 65% of the prescriptions we write, and that is part of a system called the, get ready, cytochrome P450 enzyme.
What's that?
The cytochrome P450. And the enzyme that's the problem is the cytochrome P453A4. And that enzyme is used up by CBD. And there's certain anticonvulsants that also need that enzyme in order to be metabolized. It's important because many of these pharmaceutical therapeutics have a rather narrow therapeutic window, meaning that at this level it's therapeutic, side effects are minimal. If you go up a little too much, then the side effects can be problematic. And one of those is an anticonvulsant called Onfi, and the other is Depakote. So when patients are taking those two in particular, and there are others, the list is rather long, we have to use CBD spaced apart from the dosing of those anticonvulsants, and we like for the neurologist to be on board and to follow those levels carefully. It doesn't mean that the patient can't use CBD, but we have to be careful. We have to space the CBD at least 3 hours apart from when they take these medications, and we need to follow those medication levels to make sure that we're not pushing those levels into a toxic range.
So just to clarify, it sounds to me like if anyone is taking anti-seizure medication, they need to talk to their doctor if they're going to introduce CBD into their medical regimen.
They need to talk to their doctor. And I would say in years past, it was difficult sometimes to find a neurologist, especially a pediatric neurologist, that would be supportive of using CBD. And that tide is shifting. After the Epidiolex FDA approval, it's much easier to find a neurologist who will at least support the use of CBD, even if they don't write the recommendation themselves. They can at least watch those blood levels for the pharmaceuticals and be supportive of the family's use of cannabis as an adjunct therapy.
Well, thank you, Dr. Frye. And I want to remind everyone in the audience that if you have more questions about cannabis and epilepsy, we will stay on, and you can ask those questions in our live chat, and the Hello MD doctors will answer your questions. And, well, Dr. Frye, thank you. I learned so much today, and I'm hoping that you did as well. That's a wrap for today, and stay tuned and continue to watch our Ask a Doctor series. We'll be on next week again.